Thanks for joining us to talk about how to be a gun violence prevention advocate. Just by way of introduction, I'd love to hear a little bit about your line of work, how you got to be an associate professor of health education.
I am an associate professor of health education in the Department of Health Studies and Applied Educational Psychology. In the context of what we're discussing today, I am a gun violence prevention researcher, and I specifically study adverse childhood experiences, school gun violence prevention, and school safety. And so really just very interested in the connections between health and learning. I'm really interested in how we can ensure that schools are spaces not just where kids are safe from violence, which is the very bare minimum and what all children should have access to, but really spaces where children can thrive. And I think when children can thrive, that's when we see their health and their development and their learning and their education really take off. And that, to me, seems like a core value of something we should all be pushing for and advocating for through our research and our practice-based work. When I was a doctoral student, really focused on an area broadly I would call school health, which is, again, just looking at those connections between health and learning. So, and that for me has always been an area that I've been fascinated by. As I finished my doctoral studies and moved into my postdoctoral years, really focused on a range of child health issues, including, everything from physical activity, sleep quality, substance use, poor mental health, and a lot of different health issues that, we need to think about. How do we address and intervene on and do better by our kids? And in 2014, I published a paper with my best friend, who is was my college roommate and is a professor at NYU. And she and I worked on this paper together where we looked at 10 years worth of CDC data, and we were trying to make sense of what are the factors that might contribute to a teenager choosing to carry a firearm. And I think that question was just something that was of interest. I'm not actually sure how we arrived at it, if I'm being completely honest, but I think we had just been in conversation about, just thinking about, different risk factors. And so she and I worked on this paper, and in the context of writing that paper, what we found in that was that, sure, kids who struggle with poor mental health, for example, might be more likely to carry a firearm, but what emerged from that work that feels really obvious now when I say it, but at the time, I think gave me a little bit of an aha moment, was the kids who are choosing to carry firearms with some regularity were also the kids who had been previously exposed to violence of some kind, or who just fundamentally were reporting that they did not feel safe, whether it was at school or on their way to and from school. And I think that for me was like, well, of course, if kids don't fundamentally feel safe, then they're going to do what they can to try and stay safe, whatever that might look like. And moreover, they're not going to sleep well. They're not going to eat well. They're not going to take a test. They're not going to do any of the things that we expect of children. So in the context of all of that work, I think this idea of really getting at the heart of what contributes to school safety and how can we do better by our kids, and how do we think about, the systemic factors that exacerbate these experiences, like that's really where I started getting very involved. I've been very fortunate over the past several years to connect with just so many wonderful, extraordinary colleagues and scholars and mentors in this field of gun violence prevention, and work with them. And now this is pretty much all I do from a research perspective, and I love it and feel very privileged to do this work and be in this space.
And looking at this connection between gun violence and learning, have there been any other aha moments or things surprising that you've done research on or seen in others' research recently?
And I don't know if this is an aha moment so much as a recognition of how the issue of gun violence prevention gets talked about. But, when we think about prevention of other public health issues, we tend to think about prevention in this very expansive way. So think about how we talk about the prevention of, I don't know, any type of cancer or obesity or any really type of chronic disease. We think about it very holistically now. We think about diet and exercise and access to, services of different kinds and genetics. And epigenetics, and we've really kind of expanded on how we think about prevention in this really comprehensive manner. And what I have continued to find, maybe frustrating is the right word, but also I guess just a little baffling in this space, is that in the context of gun violence prevention, we tend to be very myopic in the sense that the conversation and the public discourse really centers around maybe a few set of policies, right? Or a few sets of, I don't know, talking points. And I'm going to be very clear. The policy piece in the context of gun violence prevention, and specifically in the context of gun access, is incredibly important and needed for as we think about solutions to this issue. So we need to be having those conversations, but we also need to be thinking out of the box and looking at other solutions that really focus on real prevention, like years and years and years before a violent act takes place, in addition to more reactive strategies. So we want to think about access to firearms as one part of the solution, but we also want to think about the other systemic factors that might be driving this kind of violence. And so over the past, several years, I mean, this is not even work that I'm doing. This is work that my, again, extraordinary colleagues have done, but really looking at things like, the role of green space or street lighting or affordable housing or public libraries, real investments in communities and schools and in that infrastructure that break cycles of disenfranchisement and allow us to really think about prevention of gun violence in this more holistic way, kind of like we think about prevention of other issues, as I was saying earlier. And I think sometimes when we flip the conversation to be more expansive, I do feel like that feels like, aha, oh, we can do so much more. And we aren't necessarily relying on, a very specific policy to be the solution here. And I think that feels important, that the solution to gun violence prevention is not going to rest on one specific policy or practice. Like any other public health or frankly social crisis that this country is facing, we need to invest in solutions that are multifaceted, that draw on multiple disciplines, that are comprehensive, that understand that there is nuance and variation across geography and life course. And I just think that has gotten missed in a lot of the public discourse around this issue.
And there are two things you said I'd like to follow up on the expansive discussion, providing more green spaces and healthier environments, will lower blood pressure and just create a better community. And there was somebody from Penn, and I think a TC person also, right? Lewis, wasn't he working on looking at New Orleans?
That is Charlie Brandis's work. His work has really been at the forefront of exactly this, these place-based interventions, really shaping environments to then impact levels of community violence and specifically community gun violence, right? Which is so critical. And yeah, that work has been replicated in many places, Philly, New Orleans, Flint, Michigan, et cetera.
It's so interesting to hear that is working throughout the country. And then I know there's a group right here in the TC neighborhood called Neighbors for a Greener Harlem. And full disclosure, I'm involved. I'm kind of on their board. They're a small nonprofit that is motivated by studies like that. Access to green space and a clean environment, healthy environment. It does have lower gun violence. And then the other thing I want to follow up on, Sonali, was you mentioned gun access, and I wondered how gun violence prevention and the advocacy around it, and we will get more into the advocacy in a moment, is the same or different from being like a gun control advocate.
In general, I think we are collectively trying to move away from the term gun control. And really, instead of the term gun control, I think the use of the term gun safety feels a little more resonant with where we are in our current time and place. So we live in a nation where there are over 400 million firearms in circulation. 400 million. So there's more firearms in circulation in the United States than there are people. So we need to figure out, how do we coexist safely with this many firearms? And to do that, we need to think about firearms as being things that need to be treated, like we need to think about this as firearm safety, right? And not necessarily firearm control. And I think what we do know, and there is an extraordinary level of really just very rigorous, good quality research that has shown that specific policies, safe storage laws, child access prevention laws, extreme risk protection orders, just different assault, large capacity magazine bans, for example. There are very specific policies that we know, when implemented, are effective at reducing access to firearms for prescribed users, right? So it's not about no one having access to firearms. It's being thoughtful and careful in who does get that access and when and where and in what context. And, the idea here is, again, to say we need to coexist safely here. So I think less about gun control. And again, we all want to coexist safely. And where we need to find the common ground is how do we agree? What's the best way to do that? And I know that's hard, and the discourse is can be very challenging in that way. But generally speaking, most types of firearm legislation in what I'm just describing are very well supported by the general public. I mean, there's a lot of support across communities and, again, across geography, where there is vast support by voters for a lot of the types of policies I'm describing here.
In preparing for the interview, I saw some Gallup polls from just this past from I think September 23, around vast support by Americans of all types for gun safety, safe storage, magazine limits, and things like that. That both sides of the aisle, sensible legislation. So that was surprising, and might be surprising to people watching, that there is actually such control. So what's the disconnect between, if the majority of Americans want something, is it the message isn't getting to our legislators?
I'm not even sure that I fully know, but if I had to take a guess, I think there's multiple factors at play here. First is, again, I think part of it is just flipping the conversation over. So right now, when we think about gun safety, again, our elected officials are probably thinking very specifically about certain laws. When people ask what comes to mind when you think about gun violence prevention, they usually will mention some law, maybe something tied to law enforcement, but generally speaking, that is by and large where the conversation and discourse lies. And I think what we need to do is encourage our elected officials to think, as I was saying earlier, more broadly and more creatively, like really looking to what the research says about what works and what doesn't work. And the fact that we know so much about what works at all these different levels is really important. So I'm going to give maybe a simple example. I'm simplifying this just for the purposes of our conversation, but just to share this, like, we know that public libraries, right, can play are an important part of a community for many, many reasons. And there is research that has shown the value of public libraries in contributing to reductions in gun violence and crime. And so something that could be very simple, someone may not see our annual city budget as allocating funds towards our libraries as part of a gun prevention effort. But it is, right? And so sometimes I think part of this is simply allowing us to draw those connections. Now, libraries, I'm just using this as an example, are very important for lots of reasons, right? Gun violence is just part of this. But I think what we want to do is really kind of open up the door to say, look at all the ways in which we could be thinking about prevention that go well beyond, again, a set of specific policies. Now, that is maybe part of it, is reimagining the conversation. I also think part of it is like, and I've had individuals say this to me, and it makes a lot of sense. I'm also a mom to an 8-year-old, so I understand the sentiment, which is that I'm about to share, which is, when something happens, a school shooting happens, a mass shooting happens, it seems very reasonable and understandable that we would want our community, our elected officials, to react to that type of horrific, violent act with something equally aggressive. I feel like that inclination, that desire makes sense, right? So this notion then that we should arm our teachers with firearms, or really like lock down our schools and, keep them, protected in this way. I understand that inclination. The challenge is a lot of these reactive safety hardening strategies currently have no evidence guiding their effectiveness. And so they're expensive. They may have unintended consequences or implications for children's health and learning and development. And we don't even know if they work. Now, these are things that my colleagues and I are right now studying and hoping to shed more light on, but I offer that as an example of, the need to have some reaction. And I think where elected officials and scientists and voters all agree is that listen, gun violence is the leading cause of death right now among children and teens in the US, the leading cause of death. So what we all agree on is that there is urgency to do something, and maybe many things. What we need to find common ground on is what those things are and look like. And I think that piece feels really challenging. So something that I have often offered and tried to kind of share in my public talking about this is gun violence is a public health crisis. It is pervasive, right? We basically have organized our lives around its inevitability in many ways. So it is really just so devastating. But gun violence is also connected to all these other issues that we care about. It's connected to the economy. It is connected to learning. It is connected to other health issues. It is connected to well-being. Think about any aspect. It's connected to how our school boards spend our money, right? It is connected to every facet, every outcome we care about is connected to our hospital system, right? We need to think about like people, I think we want to tend to isolate gun violence as separate from, other things that are going on, but it's all related. So something that I have been trying to think about and been doing in some of my conversations is to say, listen, yes, gun violence is this public health issue, but it's impacting all of this. So you care about testing and learning and all of that, then we need to make sure kids go to school and fundamentally feel safe. And that starts where? With decriminalizing our school environments, right? With actually investing in positive school climate efforts that we know are effective. Taking a really good, hard look at our New York City DOE budget and looking at where our money is being spent. I mean, these are difficult questions. And our elected officials have to have the courage to do that, right? To look at what's working, to be very clear and understanding about what's not, to see where the inequities lie. That's a lot of work, but that's why they were elected.
To wind down the conversation, we think about the vast array of professions the TC community, TC alumni are in: teachers, researchers, educators, psychologists, health professionals. And it seems like ever since you said, every aspect of life is touched by gun violence, that even in those roles, whatever role you're in, you might be able to take some kind of action. And when you said, talking to your legislators, I think about this study that was in political science that was called Call Your Legislator. And it showed that it was a field study by Bergen and Cole were the authors. And it showed that even a handful of phone calls to a legislator will actually move the needle on an issue. Going back to wherever the TC or Greater Columbia or whoever might be watching this community, whatever role they're in, is there a small action that someone could take to support gun violence prevention?
I mean, you just honed in on a big one, which is calling your elected officials, and not just at the state level or federal level. It's harder sometimes, I think, to pull levers at that point. You can and should, but those can be harder to pull. But calling your local elected officials who really are playing a role in, again, budget decisions and decisions that impact your communities, and you are part of their being in office. And I do find that conversations with them tend to be a little more, or at least with their staff, tend to be a little more productive and generative in saying, okay, here's a specific piece of legislation that I would be open to moving forward. Or I understand, okay, I appreciate you taking the time to call. Exactly to your point. I mean, Matt, if you're taking 5 minutes out of your day to have that conversation, it means that it matters enough to you to call. So they get a sense of like, okay, here are the values and interests of the folks who are living in the community that I have been elected to represent. So I think that as an action feels very important. So I think that's a really a good piece. Doing our homework, like each of us, to really make sure that, okay, what are the issues at stake and play? Double checking our sources. So I think the misinformation, disinformation component of what goes around on social media, for example, lots of things where it's really good to pause and say, is this correct? Is this the right, I think doing like a little bit of time spending on what is the source that's contributing to the meme that I'm sharing or whatever. I think, and I'm guilty of this too. I think these are things we all are contending with, but I think that is important to make sure we understand and are being mindful of that. So, I feel like those are two kind of seem small, but I think are actually quite impactful in terms of like specific things we can do. There's lots of course, amazing. I know, Matt, you and I have talked about this at many points, like just lots of amazing organizations who are doing really just great evidence-informed advocacy. I think about Brady. I think about Every Time for Gun Safety. I think about, the Giffords Foundation. I mean, so many organizations who are really, again, looking at good quality data, the best quality science, and using that to inform the policies and practices that they are pushing for and advocating. So I think some of those, getting involved in those organizations, should you have the time and capacity to do that, even if it's a few hours a month, I think that can be really helpful and beneficial. And that's really how good grassroots organizing comes, right? Even if it is just a few hours a month or a few hours every 6 months, it's still valuable. So if this is, to all of our students and alums who are watching, I mean, if this is an issue that, really, means something to you, I think getting involved in any way you can is so critically important. And we want that, right? We want folks we want people involved. I think this is a field that, in an area that I'm hoping we address in our lifetime, right? That this is not an issue that my kid will have to contend with, in 30 years.
The theme of this whole conversation is this striving towards evidence-based policy. So public policies, bills, legislation, regulations that don't come out of the blue. They don't come from just a small number of folks or interest groups, but rather the public, and also, informed by folks like you who spend their careers looking at empirical evidence and continuing to refine it and test it over your career. So on that note, I know you're part of two at least organizations, the Surge organization and also a national organization for gun violence prevention. Could you share, maybe give a plug for those two groups?
So the Columbia Scientific Union for the Reduction of Gun Violence, which is a mouthful, but we refer to it as Columbia Surge for short. So this is an entity that my colleagues up at the Mailman School of Public Health and here at Teachers College and and actually right now it constitutes faculty from around the university. But in about 3 years ago or so, we brought together about 36 faculty representing seven colleges and schools across Columbia University, and now including our students and our postdocs, who are all engaged in the issue of gun violence prevention, but from a wide range of disciplines. So we have 18 academic disciplines represented, which I say that to sort of show that this entity really embodies the ethos of what I was just describing, which is to say that gun violence prevention is, yes, about policy, but it's also about being creative and thinking about this issue from all these other different lenses. So neuroscience and epidemiology and school health and criminology and law and engineering and everything in between. So really trying to embrace the wide gamut of disciplines that are committed to thinking about this issue from all these different vantage points. So Surge is engaged in so many different components ranging from, of course, mentoring and training students, the research itself, obtaining federal funding to do this work, but also in the translation and dissemination of these findings in the media, via the public discourse on, in lots of different ways, and then advocating and then engaging in efforts to really grow the scientific field of study. So, so that's really the work that SURJ is doing, and it's an entity that I'm so grateful to be a part of, and I'm really just proud of as a group, and very lucky to work with colleagues who are just so passionate and committed to this issue. So that's SURJ as a brief nutshell, and I could talk about it all day, but I won't. The other entity you mentioned is the newly launched Research Society for the Prevention of Firearm-Related Harms, also a mouthful, very hard to be brief in academia. Now, this is a national organization. It's a new society, new professional society, which is designed to bring together researchers from across the nation to promote and support rigorous research and the evaluation of evidence-based practices to prevent firearm-related harms across the life course. So we are promoting this research, nurturing the next generation of researchers in this field, building those collaborations, and importantly, having an annual conference. Now, this may not sound particularly profound, but in the field of gun violence, which is quite new compared to many other fields, because for many, many years, there was actually no or very limited federal funding to do this work, being able to have a professional society that comprises students all the way through senior scholars in this space is remarkable. I'm going to quote something that one of my colleagues said a few weeks ago, which is, a few years ago, we had every gun violence researcher, every career gun violence scientist could fit around a conference room table. And now we have a conference, and we are about to have this conference in Chicago in early November, and we have nearly 800 gun violence researchers coming, to give you a sense of how the field is growing in its scope. So what I think is so encouraging about this is that we see this field just burgeoning with expertise and extraordinary scientists, again, across such a wide range of disciplines and practice-based orientations, and it's been amazing to see that coming together. So I am, again, very proud of both of these entities and very lucky to play a role in them and work with colleagues who are making this work possible. But we very much see the scientific field of gun violence prevention growing.
And you're, I think, the head of it, right? You're the president of that.
I am the president of, yes, I am.
You got to mention that.
Yeah.
That is really inspiring work that you're doing, and just want to thank you, Professor Rajan, for your time today. And I'm sure so many alumni students will be fascinated by what you're looking at, and just recognizing the importance of it and the many ways of getting involved, being an advocate, taking action, whatever your role is in time and in your career. So thanks again. I hope we could continue the conversation and maybe have some resources and links as we post this. So really appreciative of your time today.
That's great. Thank you for having me.